Welcome to the TCM Teach Podcast designed exclusively for acupuncturists and Chinese medicine herbalists who are ready to build thriving, sustainable businesses. I'm Sabey Smith, licensed acupuncturist, herbalist, professor, coach, and entrepreneur, and I've spent years helping practitioners just like you not only master their clinical skills, but also run practices that are organized, efficient, and compliant. Today we're diving into a topic that often feels a little tedious, but it's absolutely foundational to a sustainable practice: record keeping and documentation systems. Proper systems protect your patients, safeguard your business, and allow you to focus on what you do best, your healing. So let's get started right after my disclaimer. Please remember, I'm simply a practitioner here to support you on your journey. The information shared in this podcast is intended for educational and learning purposes only, and it should not be taken as professional, legal, or financial advice. For guidance specific to your business, please consult with the appropriate licensed professional. Thank you. All right, my friends. So here we go. Why documentation matters in a healing business. For starters, patients trust you with their health. That's kind of an important thing, and detailed records ensure the continuity of care. It's helping you understand your notes and helping them see where they're going, and can also protect you if there is a lawsuit. Good documentation protects you legally and professionally. Think of this as preventative medicine for your practice. A small effort now prevents major issues later. So strong record keeping is going to help with patient safety, business protection, and of course, my favorite, peace of mind. So what are some core components of patient record keeping? These are things you're probably familiar with, but let's reiterate. Intake forms. This is going to be personal information, medical history, allergies, and lifestyle factors. Treatment notes, SOAP notes, subjective, objective, assessment, and what the plan is. And then herbal prescriptions and formulas, ingredients, dosage, instructions, and updates. It's really helpful for patients to know what they're taking, know how much they're taking, and please give them instructions on how to take it, because if they don't know how to take it, they could maybe take too much, not take enough, and think it doesn't work. Make sure that you're constantly up to date on what they're doing and getting updates from them. Consent and agreements. Signed forms for treatments, herbal use, telehealth, and of course, privacy, acknowledging your privacy operations. Billing and insurance records, payments, insurance claims, receipts, and coding details. Making sure all of those are in a row and that you have a record of them. Follow-up and outcome tracking, progress notes, symptom tracking, and patient feedback. Understanding how your patient is progressing. So again, I'm going to go over this list quickly again. So intake forms, treatment notes, herbal scripts and formulas that they're taking and how to take them, consent and agreements, billing and insurance records, and follow-up and outcomes tracking. If you are detailed like this, you're going to be running a very great professional practice. So let's talk about some systems. There's different systems and everyone's going to have a preference. Digital systems, electronic health records. This is where a lot of practices are going. There's still some that do paper, and we're going to talk about that too. And then there's also hybrid ways of doing this. So EHR, or electronic health records, these are HIPAA compliant platforms. Most true EHR system is going to be HIPAA compliant. You really shouldn't have to check, in my opinion, but nonetheless, make sure. We're going to go over some pros here. It's searchable, secure, and it backs up. Usually backs up to a cloud or something that is encrypted by the company. So it's part of the fee that you're paying for. It's searchable to help you find keywords. It really depends on the system. And the key thing is secure. Something I really like about EHR systems, if you actually are working in multiple areas, if you have multiple offices, or if you do mobile visits or at-home visits, then if you have a computer or a tablet or something where you can pull up the EHR, it's really helpful. Then you don't have to pay attention to what files are in your bag on a given day, make sure they're at the correct office. They could just be right there, ready to go on a tablet, a laptop, whatever it may be. What this is going to do is going to track treatment history, as we know. You can help keep track of billing. Most EHR systems are going to let you do billing directly, and having patient communications. Sometimes there could be encrypted messaging that you can have between patients, or there could be a messaging platform on a particular EHR system. They could schedule through your EHR system. The EHR systems are way better than they used to be, so if you haven't looked in a while, definitely give them a look. I'm not particularly endorsed by any of them. I'm just saying, based on personal experience, they've really upped their game since I had graduated from school. Next is paper systems. Organized binders, clearly labeled sections or folders. There are definitely pros here. It's tangible and it's easy. You get a file cabinet, everything's on paper, get the folder, put it in. I did this for a long time. I did paper for a long time. But let me tell you, if you move, even just personally, you have to make sure you keep track of all those documents too. So that could be kind of a little bit of an extra hassle or a pain. EHR, all you gotta bring is your computer. It's pretty easy. So the pros though, it's tangible. Paper is pretty straightforward for practitioners. It's pretty straightforward for patients. It can just get clunky over time. The cons here are you have to constantly have enough secure storage, and there is a risk of loss or damage to the records. That's not going to be a good situation. So the idea with EHR is you're not going to lose them, they're not going to get damaged. And you don't have to lock them. You just have to have things that are encrypted when you're working with them, like your tablet, your laptop. And then there's a hybrid system. Digital for clinical and billing, paper for backup or quick notes. You could totally do that. It allows flexibility while maintaining security. You can literally do whatever you want as long as you're staying within the lines of HIPAA. You're good to go. So what are some legal and compliance considerations? You want to follow state licensing board requirements for record retention. As I've said in previous episodes, you have to check based on what the board requires for you to hold, how long to hold on to the records. HIPAA compliance, secure storage, access logs, and patient privacy. Document everything consistently. If it's not documented, it didn't happen. Make sure you are specific about this. And keep track of audit-ready records for insurance, tax, and legal purposes. Just having good payment records, having good notes, making sure that your codes are good on insurance. This is just going to protect you. It's going to help you be more organized. It's going to help your business. So just pay attention to those things as you're going through the day-to-day. And that way it's going to be a lot easier when you have to check revenue, check insurance, follow up on certain claims, whatever it may be. There's another note I want to make about EHR systems too, is in the event you don't want to pay for the EHR system anymore, because many of them are subscription-based, what you can request is they can send you a file of all of the patient records that you had so that you can save them locally to a device, hopefully that's protected. It should be protected, and that way you don't miss out on the patient records. That may have changed with different EHR systems now from the ones that I've used, but I know in the past when I did use EHR and wanted to switch to a different one, I could simply ask them for the data and it was sent to me. So then I could cancel the subscription to move to a different company. Next, common pitfalls practitioners face. Inconsistent note-taking. If you have a gap in patient history, that's not really going to help you. You want to make sure it's consistent and that you're following up on all of the chief complaints, making sure that nothing is getting overlooked. You want to be thorough. Overly complex systems. These can be hard to maintain. They can lead to incomplete documentation. So while it's good to be extremely thorough, make sure it's realistic for you to maintain day to day. That way nothing gets overlooked once again. having things that are overly simplified versus overly complicated. You want to meet somewhere in the middle here. Neglecting updates, prescriptions or treatment changes not being recorded. You don't want that to happen, because if it does, and then something not favorable to you happens or to the patient, you want to be able to back yourself up. That's the point of taking notes. It's protecting you too. Then using insecure digital tools, you're risking HIPAA violations. Just do your best for security. I don't tell these things to you to scare you. It's so that you're educated and aware that there are safeguards you could put in place so you don't have to worry about it. So what are some practical steps to build effective systems from now? You can audit your current records, identify gaps and inconsistencies, choose a primary system like EHR, paper, or if you want to do a combination of the two, figure out a system that's going to be easy to replicate, and continuous and sustainable. Create standard templates for your intake, your soap notes, and your herbal prescriptions. If you use EHR, it's really easy. You just set it up once and then you keep repeating it over and over again. It's very straightforward. Schedule regular weekly or daily time for updating your records. Always make sure your records are updated, especially for accounting, for patient notes. Your patient notes really should go in at the time of the appointment. So you don't want to miss something. So pay attention and figure out a system to do that for yourself. And then train staff on consistent documentation standards and privacy protocols. This is to protect you, to protect the patient, and to protect the whole business. Make sure everyone is up to date and has proper training from you or from a professional agency, whatever it may be. It could easily be from you. So what is the ripple effect of having organized records? It improves patient outcomes through continuity and clarity. It reduces stress and cognitive load on the practitioner. It protects your practice legally and professionally, and frees up mental energy to focus on growth, marketing, and patient care, which are all things that we want to pay attention to. So I am going to leave you with this. Record keeping may not be glamorous, but it can be the backbone of a thriving practice. Just as regular treatment supports patient health, consistent documentation supports the health of your business. So when your records are organized, compliant, and easy to access, you create a foundation of sustainable, confident practice management. So I've created a resource called the Practitioner Documentation Toolkit. So that's going to provide templates, checklists, and systems for keeping your records complete, organized, and compliant. So it's going to help you figure that out and how to do it. And you'll find that in the membership. So in our next episode, we'll be diving into consent forms, policies, and protecting your clinic legally a little further in other ways that we haven't talked about yet. So until then, thank you for tuning into the TCM Teach Podcast, and we'll see you next time. Cheers.